Hello and welcome to On Call with the Prairie Doc After Hours. We had many great questions submitted beyond what we could answer during the broadcast portion of our show, so let's get started. Thank you for hanging afterwards.
Happy to do this.
So we had a question. Sioux Falls woman says, I have mixed incontinence and was prescribed Mebetric, which is mirabegron, generic. It's fairly costly. Is there another effective medicine without side effects that cost less?
So the medicines that exist for urge incontinence, she might have mixed incontinence, but the medicines are to help with the urgency, frequency, and the urge incontinence.
Right. Urge is the
I can't get
spasm.
there. Yeah, and I feel
it
like
goes
I have
in
to go.
spasm and it's a relaxer.
Correct. And so the way traditional medicines for this are called antimuscarinics. This is oxybutynin, detrols, vesicares, or sulfenacin. And these medicines work by blocking the
Parasympathetic system, the muscarinic.
Yeah, the muscarinic receptors, but it's so as the muscarinic receptors get activated, the bladder contracts, and what the medicines do is they block the receptors from signaling the contraction, or blocking that parasympathetic or contraction. Mirabegron is a newer medicine that came out a few years ago that is what's called a beta-3 agonist. And what the beta receptors do is they help relax the bladder. So as that medicine is being released, it's promoting the bladder to relax more so it holds more and you don't feel a sense of urgency. And so they work differently. If she's failed other antimuscarinics, there's no other medicine in that class, and so that's why it's expensive, because there's no generic form of it. Also, most of the medications work about 40% of the time, but you have to give time for those medicines to work, so don't take it for 3 days and not see any results. For most antimuscarinics, you need to be on it 3-4 weeks to see a significant improvement that this medicine may or may not be helpful to you.
This one, the beta agonist.
With the beta agonist, or what's called Mebetric or mirabegron, sometimes pushing that medicine out 6 to 8 weeks or a little over a month for the higher dose is beneficial for people to see whether or not it's worth taking.
And how much does it cost per month?
Well, that's variable on people's insurance and if they have a copay, or if on what kind of formula they have for a supplement for their Medicare.
But if you had no coverage, it'd be $600 a month?
I don't know if it'd be that expensive, but it's a couple $100. The other thing with
medicine,
Mebetric or mirabegron, because it's not an antimuscarinic, you don't get the dry eyes, dry mouth, constipation symptoms that you typically are associated with side effects with antimuscarinics.
Do you have other side effects?
Mebetric, typically some people might feel a stuffy nose or a headache, or sometimes it make them hard for them to urinate would be the more common side effects.
Okay, very good. So, is there a relationship of urinary issues and lichen sclerosis? So explain what lichen sclerosis is, and also, do some foods make problems worse or better? So is there a food issue that we could address?
Well, I'll start with lichen sclerosis. Right. Lichen sclerosis is a skin condition on the outside of the vagina, or what's called the labia, and the area between the rectum and the vagina, and sometimes around the anus, where the skin is an autoimmune disease, meaning your body's reacting to itself, where it thins the tissues, it narrows the tissue. Scarring, where sex might be painful, or it can cause severe itching. And it's more common as women become menopausal. And most of the time, it's not really associated with a urinary issue per se, other than maybe some low estrogen, maybe some recurrent infections, but I haven't seen anything that correlates with any urgency or frequency.
And it's an autoimmune disease. It's like
lupus, thyroid disease, it's Raynaud's syndrome, diabetes. It's those types of things.
You just can't.
But she does bring up a good question about food. And I think one of the few modifiable risk factors, meaning things that you personally as the patient can change in your life, is weight loss. Weight loss helps with stress incontinence. It can cure stress incontinence if you lose 5-8% of your body weight. It can help with urgency frequency by losing weight. So choosing the appropriate foods are helpful. There are also certain foods that might be more diuresing, meaning they make more fluid production, such as caffeine or certain types of sugars and chocolate and those types of things. Right. Coca.
A viewer would like the docs to describe Kegel exercises in more detail. You want to explain that one more time?
So,
because I think it's really important.
So with Kegel exercises, is you have this bowl of muscles that the urethra, the vagina, and the rectum go through. And when you do a Kegel exercise, all you're basically doing is you're lifting those muscles up, meaning contracting them, all right? And when you relax, those muscles relax and you're able to urinate or defecate. And contracting those muscles, you want to be able to squeeze those muscles, but sometimes you got to make sure you're doing it right. So seeing your provider and assessing that, or seeing a physical therapist. So when you do a Kegel, you're going to want to contract that and hold that for 10 to 15 seconds, and then relax it, contract it, and do that repetitively for long periods throughout the day, doing it multiple times throughout the day.
200 times, I've heard.
Yeah, you know, a lot.
Every time you smile.
Yeah, but there's not one specific number, you have to do this, all right? But I like your idea of smiling because it encourages people to smile more.
Yeah. And, I think it's that same muscle that you use to stop defecation, to stop bladder flow.
Correct. So that's where it helps with urgency. So when you do a Kegel and you contract those muscles, it's helping that sense of urgency. What I don't want people to do is try and see if they're doing it right by sitting on the toilet and trying to contract in the middle of while they're voiding or urinating, because it sends the wrong signals to the brain. You're telling the brain to do the opposite muscle contraction that you want it to do. You want the bladder and the muscles to relax while you empty. So I do not encourage that, and that's been kind of a thing that's been historically told to people, is to try and contract during voiding, but don't do that.
Don't do it then. Woman from Sioux Falls, I have a constant flow of urine all day and nothing will stop it. And this has been happening for many years. Help. My answer is, see Matt Parker.
I think in that case where it's a constant, and doing that diary, making sure there's no associated symptoms, what you have to be really careful is if they've had any other prior surgery or radiation or cancer treatment, that sometimes they can get a communication which is called a fistula, where that urine just constantly leaks out, and making sure it's coming in from the vagina or the urethra, right, is key.
Okay.
But there is help. There's some third-line therapies if the medicines don't work. She'd be a great candidate for Botox.
See an expert.
See an expert.
From Facebook, what surgery might you do for a prolapsed uterus, bladder, and bowel, and what should be necessary? So prolapse is what?
So prolapse is basically, think of that, the organs that are supported by the pelvic floor are herniating out through the vagina. It could be the bladder, it could be the uterus or womb, it could be the rectum or the top part of the vagina if someone's had a hysterectomy.
Pooching out of the
bulge.
vagina.
Yeah, they'll feel something coming down. And there are many different ways to treat that, and it's kind of individualized. And if they've failed non-surgical options, which is like a little pessary, they could do that. The controversy is that there are some people that believe any person that has surgery for prolapse should have a sling or an anti-continence procedure done at the same time to prevent the potential risk of developing stress incontinence.
And you believe?
I'm more conservative because putting a sling in is an easy procedure to go back in and do. And if I'm putting something permanently in a person, I want to be pretty darn sure they need it. And so I usually test them ahead of time to see if they have any leakage, and that's why they need to be assessed by the surgeon before they have any surgical
And you never
correction.
use mesh when you're resolving a prolapsing whatever?
Yeah, it can be used in some certain circumstances. I traditionally do more using people's own tissue, unless they've had other surgeries before. Sometimes I might go through the abdomen and place a mesh through the abdomen, which not having the legal issues that we're seeing with some of the transvaginal mesh products that were available at one time.
A female from Brookings says, I've heard that some doctors tell their patients to drink less water due to their incontinence. Does this really help, or will it cause other tissue issues in the body? And how can I know how much to drink when I have incontinence?
I think drinking a healthy amount of 8 glasses of water is kind of standard, and you get water and food. Some people with recurrent infections flushing out their kidneys, drinking a lot of water. Some people feel better. Their exercises, their activities might require more fluid intake. I think telling someone to restrict their fluids isn't really fair. There's probably other things we can do. I think it's more important to restrict fluids that caffeine, sodas, alcohol, things that can be a diuretic. That's more important in limiting those factors rather than just cutting out all water. There's a lot of push now for people to drink high volumes of water for weight loss, and cutting back on some of those things might help their sense of frequency, but it wouldn't necessarily change incontinence.
I think there are places in this society to say push water, push water, push water, and I think if you have an incontinence problem, don't push. Just drink water when you're thirsty.
Correct.
So do you have a standard amount of water to drink? And I would say the answer is when you're thirsty. All right.
Yes.
A caller says, I have interstitial cystitis. We talked about that. And a bladder pacemaker that works great. I still struggle with emptying my bladder fully. Is there a practical way for women to empty the bladder more fully?
So she has this device in her back that basically stimulates the nerves that innervate the pelvic floor, the sacral nerve root. So it's not in her spinal column. It actually goes in where her tailbone is. And this wire helps kind of
Stimulate the bladder.
But it can help with urinary retention, it can help with urgency frequency, it can help with fecal incontinence, accidents of stool. We're not exactly sure how it works. We know it just helps some women. And in her case, it's probably helping her empty a little bit better, but sometimes leaning more forward, sometimes elevating the legs in the bathroom to help both with urinating and defecating can kind of help open up the pelvis like we'll often do during childbirth. That helps open the pelvis. That might help her empty a little bit, or seeing a physical therapist and learning some exercise techniques to help empty better might help improve her symptoms there.
So my wife and I have been doing some traveling and in a variety of homes, visiting homes, and I found these things in the bathroom that you put your feet up on, or that's what they're made for, which blows me away. I mean, I was not aware that people are doing that. Explain that a little bit. How effective are those devices? Well, there's just simple little things to put your feet up.
They're cheaper. They don't have, some places don't have a pot to pee in.
Yeah.
All right, but in those cases, they're basically you're squatting more. So
put your feet up.
But that helps open up the pelvis. It's a more natural way for someone to urinate or defecate. But where we live in our society, we have these very high toilets, which can be helpful for people with difficulty with walking or disabilities. But for the routine person, being able to put a little flexion in your legs and in your hips probably will help facilitate a more healthy normal bowel movement or urination.
If you're designing your house or you're redoing a bathroom, get a higher toilet. I think we should all be preparing our homes for disability. But you can also put these little things that would raise your legs up and that does help.
But I think you bring up a good point is for people that have elderly parents who have some urinary issues or who wake up frequently at night, the most common area where people fall is the bathroom. And having handrails, that's the first area. That helps people maintain their independence because, as you know, and you've talked about hip fractures on the show before, that is a terrible thing that happens when someone's elderly. It can lead to them moving into a nursing home.
I had a previous disorder, extreme urination, with volumes of 10 cups within 8 hours. She was very weak, low sodium levels. What is this condition? So a person who
I probably have diabetes insipidus, I'm guessing, just from what she told me.
So a volume of 10 cups per 8 hours, so a lot of volume.
Yeah. So
weak, low sodium level.
Yeah.
Sounds diabetes insipidus.
It sounds like diabetes insipidus is just how you regulate fluid in your body, and it can be either from some brain trauma or something in the brain, or sometimes people with cancer can develop these things. But I can't give her specifics in that case. But she brings up a good point about polyuria, meaning excessive production of urine. And you can see that in people who have diabetes, both types 1 and 2. And I think a epidemic that we are not addressing is nocturnal polyuria, meaning you're making more than 30% of your total volume in a day at night. You should
not able to concentrate it at night.
You're just making a lot of, and that is often associated with sleep apnea. And obesity and all those things related, and correcting the sleep apnea has the potential to help regulate the volume production of urine at night.
We are not making that diagnosis of sleep apnea enough. I would say this though, anybody who has edema in their legs, could be venous disease, could be too much protein leaking into your urine, but commonly it's also heart failure. You got edema in your legs, you lay down at night, you put your legs up, all that fluid gets back into your circulation, which goes to your kidneys, which goes into your bladder, and you're up all night long.
Yeah, and another thing too is those people who do have congestive heart failure, once they have edema, that pitting edema, that swelling in the legs, it's pretty bad at that point because the legs can hold a large volume of fluid. But the other thing is a lot of people are on diuretics. diuretics is a common problem causing urgency, frequency, and I tell patients to kind of time their diuretics for social reasons, or if they're waking up a lot at night, there's making a lot of urine at night, trying to take their diuretic 6
Early.
hours before they go to bed.
Right.
Don't take it at 8 in the morning.
I think we have solved the problem. The bladder pacemaker interstitial cystitis, we did that one. Drinking less water. I think we have done the trick. Thank
I
you
hope people
so
have
much for being here.
Oh, thank you, Dr. Holm. This has been a wonderful experience, and it's always a pleasure, and it's great to see you, and I'm glad you're feeling well.
Thank you, Matt. And thank you for joining us on our Facebook page. We appreciate all of your questions and the opportunity to answer them. So until next time, from all of us at On Call with the Prairie Doc, stay healthy out there, people.